This is Talk of the Town, a weekly program featuring community events happening in and around Northeast Michigan, with your host, Nancy Smitham, and get the latest news from Alpena Community College with Dr. Olin Joyton. And now, today's Talk of the Town.
Good morning and welcome to Talk of the Town. I'm Nancy Smitham. My first guest today is Jennifer Allsup from SSVF. Hi, Jennifer.
Hi, how are you doing, Nancy?
Good. It's been a really long time since you've been on, so I'm really excited. And I know what SSVF stands for, but why don't you tell our audience what it is?
Right. SSVF stands for Supportive Services for Veterans and Their Families. And we are a program that is run out of NMCAA, which is out of Traverse.
Okay.
And I cover the 5 counties on Northeast Michigan. So I cover Alpena, Alcona, Iosco, Montmorency, and Presque Isle. And
wow.
Yeah, we help vets that are either literally homeless or in a situation where they're about to become homeless. They have an eviction notice. If they know they have to get out, our program can come in and kind of do some mediation with the landlord and help them secure their housing so they have a place to stay.
You know, what a wonderful program, because we have so many wonderful veterans in our area, and, you know, they're by the grace of God go I. You never know what's going to happen in your life.
Definitely.
And, you know, a lot of them come back with medical issues too, and which, you know, has a impact on their job, their earning capabilities, and the issues that can resolve in families with PTSD or all the other things that they can do. So give me an idea of what your services would involve.
Well, basically, we help vets who fall into our income guidelines, first of all. For an example, for a single vet, he or she, I should say, can't make more than $19,000 a year.
Okay.
And going up to a family of 4, for another example, that family of 4 cannot make more than $27,100 a year.
Okay.
And so they have to fall within our income guidelines, and they also cannot have a dishonorable discharge.
Okay.
They can have, of course, honorable, general, medical, general, under honorable, just anything but a dishonorable discharge. So those are the 2 main things that we look for eligibility into our program. And so once we establish eligibility, we come in and assess the situation. If they're literally homeless, we try to, hit the ground running and look for a place as quickly as we can. We Craigslist, newspaper, word of mouth, any sort of apartment openings we can think of, we try to get that vet in there as quickly as we can. We are a housing first model, which means that we try to get housing as soon as we can over any other sort of case management. We do provide case management, but that housing is first. Okay. First and foremost.
So then the case management would involve things to make sure that they can stay in that house or keep safe and adequate housing.
Absolutely. Once they're in housing, we do once a month case management visits, which would entail things like budgeting, landlord mediation if there's a problem, help with job assistance, job searching, things like that. And I use a lot of the community partners here in town because there are many.
Yes.
So I have a lot of great resources to pull from and connect the vets to those resources.
Okay. So how do vets get in touch with you? You said you cover 5 counties.
Yep. In October, we established an intake line, which is a line that goes straight to our intake specialist over in Traverse. And if those vets are in one of my 5 counties, it gets filtered down to me.
Okay.
And the number is 1-844-900-0500.
Okay.
And they would call that line, and if they're one of my vets, they get put on my caseload, and I would call them and set up an initial appointment, which is the initial paperwork, discussing their eligibility into the program, what needs to happen next, what are some of their things that are kind of popping that we need to address.
And, I know a lot of vets out there that are so proud, and this is really hard for them. So do you take referrals from other people then too?
Absolutely. That's one of our biggest referral services, because what I've found, and some of my coworkers have found, is that veterans are a very proud population, and they necessarily don't want to reach out for help because they're used to being self-sustaining. They can solve it themselves. They've been overseas in wars. Why can't, I solve my housing crisis? And so lots of times they don't want to reach out to us themselves. But a family member will say, hey, my brother's camping. I know he doesn't want to be camping. Can you help him? And we can go in and assess the situation and try to help the guy.
Okay, now do you have any regular office hours anywhere established, or?
I don't. Because I cover 5 counties, I'm kind of in and out. But my office is in Michigan Works in Alpena and Chisholm. And I'm always willing to meet there, but most likely, since I do cover 5 counties, I do make house visits or visits to a library in town. So definitely I go to them a lot because it's unreasonable to ask someone in Tawas to come up to see me in Alpena.
So as we're taping this show and it's going to air, any employers out there that, you know, are interested in hiring vets, they would be a good referral or a contact source for you too.
Definitely.
Because there are a lot of employers in town that want to hire vets first.
Yep. And where I work at Michigan Works, we keep a board of people willing to hire vets, and that's always a good resource too.
Okay. And I guess what I'd like to say about your program is it's just a wonderful program, and you help so many people that, you know, don't be too proud to call. And if you don't qualify because of income guidelines, you know, you have other community resources that you can refer them to.
Absolutely.
All right. Anything else we want to add today?
Mainly that we just work with rentals. And so folks that are facing foreclosures, feel free to call me because I have some, you know, resources I can refer you to, but mainly we just help folks that are in a renting situation.
Okay. And one more time, give us that new number.
The number is 1-844-900-0500, and that goes to our Traverse City office.
Okay. And where does your funding come from, Jennifer?
The funding comes from the VA. We're a VA grant program, and every year we have to reapply for funds. And so coming up soon, within the next month, we have to reapply again to get the funds to sustain our program.
Okay. Well, thank you so much for being here, and thank you so much for the wonderful services that you provide in our community, and much success to you and your team.
Thank you.
Thank you. I'll be right back following these messages. Hi, welcome back. My last guest today is Susan Bowen from NEMSCA. Hi, Susan.
Hi, Nancy.
It's been a long time since you've been on.
Yes, it has.
And today we want to talk about volunteers that are needed to help people explain Medicare and Medicaid and the baffling stuff that goes with it.
Yes, as everybody is well aware, Medicare is a very complex, confusing issue. And when you put Medicaid into that mix, it can really have people a little bit overwhelmed and sometimes a little scared that they're making the right decisions or don't have enough information. So the Region 9 Area Agency Division part of NEMSCA offers the Medicare Medicaid Assistance Program, or as we refer to it, MAP. And we have a team of about 40 volunteers off our 12-county area, and they assist seniors and persons with disabilities who are on Medicare in understanding what their options are and helping them enroll in appropriate plans.
And the plan enrollments they're a timed thing. So you have to think, oh my gosh, I have to get in there, I have to meet with someone, I have to figure out what's best for me. And depending on your income, depending on your health, your needs, I mean, it can run the gamut.
It can, and you know, what you're referring to is the open enrollment that we have every fall. But we have a need for counselors year-round.
Okay.
And right now we're in the process of recruiting more team members.
Okay.
And we will have a training in Alpena in June, at the end of June. And it's a 5-day training. It is a big commitment.
Okay.
But we're looking for people who are good at solving puzzles, like helping other people, are very computer literate because all of our work is done on the computer, all of our research and data entry is done on the computer. So we're looking for some new teammates.
Well, I just think it would be great to be a volunteer because then maybe I could finally understand everything that goes with it. And then to further add to that, you get phone calls and letters from people from Omaha Health and and Molina, and all these people get letters in the mail and stacks of information. Choose us, this is what you need. And it's just like every time I open it, it just gets more and more confusing to me.
And the wonderful part about our program is that our main focus, our only purpose, is to help beneficiaries understand what their different options are. We don't make decisions for them.
Okay.
People will ask for a recommendation. We don't give recommendations. We merely explain your choices. So when someone does make a decision, they're making it with educated information.
Okay. And so the assistance that you provide for Agency 9 is for people with disabilities, or it's income-based?
No, our service is free whether you're a millionaire or at the federal poverty level. Our counselors help everybody and anybody as long as they have Medicare and have questions. We're willing to help.
All right, so in the 9-county area, someone gets Medicare for the first time. baffling, all the paperwork that comes with it. It's just kind of crazy. How do they access your services in the 12-county area to meet with someone face-to-face, which is the best way to learn, I think?
We have counselors in every county,
Okay.
although some counselors, we have some counties with more counselors than others.
Okay.
And if we're low on counselors in a community, they get to work with me as the program supervisor. I fill in. And there's a 800 number, a toll-free number.
Okay.
And they just call that. It will go to someone in their community, so they're
Oh,
speaking
great.
with someone there.
Okay. And I know in Alpena, you can go to the Alpena Senior Center. You can make an appointment.
Yes, you can call any of the senior centers
Okay.
in our local region.
And I do have to say that an appointment is necessary because I watch, when I go there for something, I watch those ladies one appointment after another continuously.
Yes, it's especially during the October 15th through December 7th enrollment time. We could work 24 hours a day, 7 days a week.
And now if someone, has it, they're kind of okay right now, but their situation's changing, then there are different options for them within the program, correct?
Yes, there are. They can look at their plan, and we encourage they look at it every fall to make sure that whatever prescription coverage they have now is going to cover what they are taking in the coming year, because plans change, their premiums change, their formularies change, their pharmacies that are preferred change, and so we do recommend that. But also if a person is struggling with paying for their course, we're able to help with that. If they are income qualified, then we can apply for a subsidy for them.
Okay, well, I wasn't aware of that. So
Yes.
income qualified, if you're having trouble paying for your medication, you can contact the senior center, and you don't have to be a senior. What if you're somebody on disability?
If you're someone on disability, some of the senior centers aren't able to serve,
Okay.
but they will take your information and you will get a call from me.
Okay, wonderful. All right, so painless, easy, sit down face-to-face with someone and go
Yes.
through everything. And consider being a trainer, because we really need trainers. When you think of 12 counties and all the people who are on Medicare or Medicaid and need to be served or need to get the correct information,
Right.
rather than listening to something that comes in the mail or trying to make the decisions based on the propaganda.
Exactly.
Okay, one more time, that 800 number.
800-803-7174, and it will go to a local person.
Or any of the senior centers in your community, and almost every senior center every community has a senior center. So contact your senior center and say, hey, I need some assistance, help me out. And
Yes.
And I'm really so glad you're there, because as we talked before we started taping, if your health isn't good, or if you're alone, or you're struggling,
Very confusing.
It can be so confusing for someone who isn't doing any of those things, let alone having all those issues on your
Right.
side too.
Right.
Well, let everyone know that we greatly appreciate their service in our community.
Thank you.
Thank you. Please stay tuned for Dr. Olin Joynton following these messages.
Good morning, everyone, and welcome back to Talk of the Town. I'm Olin Joynton, president of Alpena Community College, and my guest this morning, Leanne White, is an ACC student. Welcome to the show, Leanne.
Thank you.
Thank you. Appreciate your coming out and speaking with me. You are also a recent recipient of membership and recognition for the All-Michigan Academic Team, which we'll get to shortly. But first of all, a little bit about you. Where did you grow up? Where did you go to high school? And how did you come to ACC?
Well, my dad was military, so I kind of grew up a little bit of everywhere.
We shared that we have that in common.
A little bit. There's not really a hometown.
I don't know where I'm from.
I don't know either. Actually, my mom graduated from ACC.
I see.
We had moved to Atlanta, Michigan, so that's where I graduated from high school. And she graduated the CMA program at ACC and encouraged me to definitely go back and get my education, get a career, not just a job.
Good for her. Well, thank you, Leanne's mother. I know you're out there watching your daughter. And when did you begin ACC?
I've been at ACC, this is my third year. I'm really ambitious, and I actually want to graduate with 2 degrees, so
Wow.
I'm taking a little bit longer.
Are you a
but
little bit ambitious?
Just a little.
And what are those degrees in?
One will be an associate in applied science for medical billing and coding, and the other will be an associate in science for mathematics. my long-term career goal, I would like to be able to do medical billing and coding from home so that I have the time to substitute teach math at the middle and high school level.
Very good. And for those members of the audience who might wonder what's the difference between applied science degrees and science degrees, the former are designed to lead directly to employment, while the latter are designed for potential transfer to university for someone pursuing a bachelor's degree or,
Correct.
or more. So what is medical coding and billing all about?
Well, anytime you go to the doctor, whether it be your general physician, eye doctor, foot doctor, whoever it is, there are certain procedures they have to diagnose you, and then there will be certain procedures that they do that they're in the office. Well, as you and I both know, living in different parts of the country, not everyone talks the same. So billing and coding is essentially a language where you take the diagnosis and the procedure, you translate it into a code, and then you send that code to the insurance company so that every insurance company understands the diagnosis and the procedure the exact same way.
So what might be called an analysis in one part of the country and a procedure in another part of the country would have a single code, a unique number, and could be submitted in an unambiguous way to an insurance company for appropriate billing.
Correct.
Well, that sounds like a good thing to do as we recognize medical practices, national, international. Are there international applications of this code, or is it
Yes,
just
absolutely.
Okay, so
the world,
in Belgium or Brazil,
Yep,
the same numbers would apply?
The
That's
World
pretty
Health
interesting.
Organization has the same standard code.
No kidding. That's pretty interesting. And then math, everybody knows what math is, and
Yes.
you're one of those wonderful people who happens to love the subject.
I do.
And to be able to do some teaching with an associate's degree at the high school on the with the associate degree, that's really good. And I wish you well. Now, last month we were in Lansing together, and you were selected for membership in the All-Michigan Academic Team on the basis of your participation in Phi Theta Kappa, which is the 2-year Honor Society organization.
Yes, sir.
And tell me a little bit about that experience. I mean, I already know about it, but really tell the audience.
It was a really fun experience. It was nice to be recognized for the hard work and the accomplishment. It was great to go down with you as well as Don and Nancy both. It really made me feel like the college is definitely there supporting me, to know that the upper people in the college want to be there to share that experience and to present me and say, we're proud of you as a student. Being introduced to the Senate was definitely a once-in-a-lifetime experience. I don't think I've ever seen that view.
Senators in action, close up.
Yes. The ceiling tiles in there were really cool. I'm not sure if that's something that every guest that visits the Capitol building gets to see, but that was really neat. Each tile had a different state on it.
Yes.
The whole experience, getting to hear what people said nice things about me, and then getting to hear other students and their accomplishments, things that they've overcome.
Yes, just about every community college in Michigan, all 28 or close to it, had at least a couple of students, and there was an opportunity for each honoree's story to be told briefly, so that everybody could appreciate kind of in an aggregate way the accomplishments of outstanding students at community colleges in our state. And so that was really interesting, and very proud of you and Brennan representing us so well. Goal number 2, as prescribed by the ACC Board of Trustees, enjoins those of us who work at the college to achieve excellence in various areas of educational programming, including both the transfer and the vocational training, and you're part of both. And so, actually, you made my job easier, because I can now go back to the trustees and say, look, we have examples of excellence in you and Brennan to be able to demonstrate fulfillment of that goal. So I appreciate your participation in the activities. Anybody in particular you'd like to mention at ACC who helped you, inspired you, just contributed to your success?
Well, I think Mr. Lewis would definitely be at the top of the list. I don't think I've had a single bad instructor at ACC. You guys do a really good job with hiring. But Mr. Lewis especially, he teaches math, and I guess the way that he teaches math is the way that I would like to teach math, and that's to make it understandable and to relate it to people that maybe didn't like math before and just needed to be related to a little bit differently so that they can enjoy it.
Well, that's a great testimonial, and Mr. Lewis is indeed acclaimed by all who have any knowledge of him as a personal acquaintance or on a professional level or as a student. And I can speak from my own experience. When I began teaching, I thought about the best instructors that I had, and I wanted to be like them, but in my own way. And I know that you're going to carry that out with your instruction. Well, I really appreciate your being a guest on the program this morning. Congratulations to you on your success. And let's also recognize another member of our faculty, Lisa Schultz, who takes time to be the faculty sponsor of Phi Theta Kappa. So thank you, Lisa.
Yes.
And when she can bring along people like you, I know she's doing her job well. Well, good morning.
Thank you.
Town with Nancy Smitham and Dr. Olin Joyton. For a list of events taking place in Northeast Michigan, visit our website at www.wbkb11.com and click on Community. This has been a Thunder Bay Broadcasting Corporation production.